Hello and welcome to my channel. Today we are going to talk about pseudomembranous colitis. It is a disease which is caused by Clostridium difficile. Now the overview of the treatment, and then we will talk about pseudomembranous colitis in detail. So the first line treatment is oral metronidazole for 10 days. If the disease is recurrent or if the patient is allergic to metronidazole, then oral vancomycin will be the treatment of choice. So now we will talk about pseudomembranous colitis in detail. Pseudomembranous colitis is a severe inflammation of the colon which is caused by the overgrowth of the Clostridium difficile, typically following an antibiotic use. We will talk about these antibiotics in the next slide. So it is characterized by yellow-white plaques or pseudomembranes, which is the characteristic finding on the endoscopy within the colonic mucosa. So I will explain the pathophysiology with a diagram and then we will come to the text. So whenever a patient is given broad spectrum antibiotics, it will result into decrease in the normal gut flora and will cause a overgrowth of the Clostridium difficile. The Clostridium difficile is one of the organism which is a normal flora of the large gut, but its overgrowth will become a problem. It will start to produce toxin A and toxin B, which will start to damage the colonic mucosa. As a result of damage to this colonic mucosa, there will be development of pseudomembrane. Apart from this, there could be development of ulcers as well as plaques can also develop. So in the pathophysiology, what is important to note is that these antibiotics, which is the clindamycin, cephalosporin, and the fluoroquinolones, they are notorious for causing pseudomembranous colitis. Toxin A and B are going to produce damage to the mucosa, and as a result of this, pseudomembranes will develop. Talking about the clinical features, the patient will develop watery diarrhea, which is often profuse and foul-smelling, in association with abdominal pain and cramping. Patient can also develop signs of sepsis and signs of shock, which include fever, increase in the WBCs, hypovolemia with associated electrolyte imbalance. In severe cases, there could be development of toxic methacolon or perforation, and full-blown sepsis can also develop. So now we will talk about the diagnosis of pseudomembranous colitis. Very first thing is that it is a clinically diagnosed